Guys, I want to watch this short clip about children being recommended GLP-1 medications. As a former overweight individual myself at 16 years old, hitting 300 pounds. Let's just watch this video. I think it's a good idea.
A survey from Kaiser Family Foundation found 1 in 8 adults have taken weight loss drugs like Ozempic, Wegovy, or Mounjaro. But demand for these drugs has also skyrocketed among young people. And with childhood and adolescent obesity cases tripling over the past 3 decades, the American Academy of Pediatrics now recommends weight loss drugs for some younger patients. Janet Shamlian tells us why.
My knee-jerk reaction is to say that this is a good thing. Remember, guys, I was a 300-pound 16-year-old, so I absolutely understand what it's like to be overweight in this day and age and get the insane amount of ridicule I got and how much it affected my well-being and emotional health is an understatement. So something this powerful that I understand how it can be used safely, I think this is a good thing.
15-year-old Jeremiah Jimenez weighed 350 pounds by the time he was 13. But after less than a year on the weight loss drug Wegovy, he lost 65 and hopes to drop 80 more.
What's that like?
It feels good. I just feel stronger because I've incorporated strength training as well. So I just feel empowered.
These are once-a-week injections?
Susie Jimenez says she talked to her son's doctor about whether it would be suitable for him after she dropped 70 pounds on the same type of medication.
He's turned into a different person, like his light has just been lit.
The number of prescriptions for young people for what's called GLP-1 weight loss medications is skyrocketing, from more than 8,000 a month in 2020 to more than 60,000 a month in 2023. They're FDA approved for adolescents 12 and older. More than 20% of adolescents are considered obese.
There's no off-ramp for these drugs that we know of yet. So putting an adolescent on them sort of means a lifetime of being on them.
Maybe, maybe not.
There's no off-ramp is a fair statement when you guys understand that there's never going to be an off-ramp. An off-ramp means that there's a company that has millions and millions of dollars to do trials where the end result produces less medication. And you guys know that's never going to happen. So there's always never going to be an off-ramp. So to use the fact that there isn't an off-ramp that's established as a reason to be concerned doesn't make sense when it's never going to be proven. Got to understand that.
Maybe not. I'm hoping over time we learn how the off-ramp works.
Dr. Stephanie Sisley, who doesn't treat Jimenez, is a pediatric endocrinologist who says while the medication's long-term effects are unknown, the health risks associated with obesity are undeniable. The biggest problem she sees are insurance rejection.
Without a doubt. Yes, we have so much to learn about the long-term complications of somebody staying on them for the rest of their life. And that's a little scary because we don't know, but essentially, clinical rationale from what we've seen so far, it's pretty reasonable to say that unknown is more likely a much lower concern than staying obese, especially when started at such a young age.
Insurance rejections.
70% of our patients are not able to get the medication.
Jeremiah's prescription was $1,100 a month until his deductible was met. It has since dropped to $25.
Big breath. Chest out.
Jimenez now works out every day and says he feels great.
I finally have something that works for me. I don't have to drastically change my diet. I just eat in moderation.
I think for me, it's been the best decision that I have made for him because I've seen him struggle.
Alongside behavior changes and with supervision, experts agree it can be a winning combination for young people with a lot to lose. For CBS Saturday Morning, Janet Shamlian, Austin, Texas.
Good for that kid. Yeah, that gets me a little worked up. You know, I was right there, 300 pounds at age 16. And so this is part of what really fuels my passion is both for adults and children and adolescents as well. Pushing these medications on children, right? That's what we're here to talk about. That's what I want to share with you is just a quick thought on it and how I feel about it. So getting back to the scenario we're looking at, look, it's clear that childhood obesity and obesity in general is, we're so far from understanding it. We're so far from getting to the root cause and getting a grip of why this is happening. I happen to be one of many, many, many doctors and clinicians that understand and believe that the metabolic health, the insulin resistance paired up with inflammation are probably the biggest culprit right now. This is the biggest problem. I wanted to interrupt the show for a minute and tell you guys about this amazing peptide guide. I'll link to it in the show notes. This is going to break down exactly how to approach peptides, what they are, your dosing protocols, your dosing schedules, just to have a deeper understanding of exactly how we approach these peptides for long-term health maintenance. These peptides are amazing, but you have to know what you're doing. So again, I'll link to it in the show notes. Now back to the show that we have. What's driving the insulin resistance? What's making an individual so much more insulin resistant at such a younger age? That is what needs to be determined. Is it all food? Is it all nutrition? No. Is that a huge piece of it? Yes, which is why you can focus on lifestyle, because that's the area that we have the most understanding of, right? Lifting weights, being part of a good exercise program, eating less processed foods, eating less carbohydrates, and possibly eating less plants, which is, don't get me started there, but the carnivore diet is a whole new area that we need to consider. And the effects of having plants in our diet being very pro-inflammatory might be the reason why some of you are insulin resistant and nothing is working. So, but outside of nutrition or lack thereof exercise, we have other areas that could be driving. I think toxicity is a huge one. I think endocrine disrupting chemicals are rampant, and we're learning and seeing so much more data behind forever chemicals. These toxins that are going to be in our bodies for the rest of their life. We're seeing children for the first time ever being born obese. We've never had obese babies upon birth. Now we see this. We see people being born now with disruption to their endocrine systems already because of exposure to toxic chemicals from mom. So we're in the middle of a lot of problems hitting us all at once. And I think it's going to be damn near impossible for us to ever hit a point where we can have a high level of confidence isolating exactly what it is. And so the best thing that I think anyone can do, if you're a parent watching this for your children, or if you're watching this yourself as a younger overweight individual, it really all starts right here. It really starts with making that decision to change, making that decision that there's a problem that you need to fix. Like, nothing's going to matter. You have to want to fix the problem. And before you even decide to fix the problem, you have to understand that you have a problem. There has to be a problem there that's real to you. You then have to understand how it's affecting the quality of your life. Then you need to start thinking about the fact that it's going to get worse before or on its own if you don't do something about it. And then after you move through your awareness of these various stages, you can then arrive at, I need to do something. Once you're there, once you're ready, once you know you want to lose weight and you want to improve your health, then and only then can you have a starting point. I think after that, what we do is obviously the next big battle, and how we approach this. GLP-1 medications, I think, they're a stepping stone for sure. And they have to be part of a more comprehensive program that involves many pieces: the nutrition, the diet, the mindset, focusing on improving your health in as many categories as possible. If you prioritize that, at least what I can tell you, what we've seen in my clinic, because we have thousands of patients on these medications, and in my coaching programs, the individuals that implement proper lifestyle interventions at the same time, they do so much better. They don't have to continue to increase their dose. They're able to stay on much lower doses. And I think this is really, really, really important to understand, and should be the goal if you are thinking about putting your child on one of these medications. That's just food for thought. We have had a couple children that we've worked with. We have a couple YouTube videos in our playlist. You guys can check that out with younger people having a lot of success, and we put them on lifestyle interventions. So if you guys enjoyed this video, check this video out right here, which is going to take a deeper dive into what our protocol is all about. We'll see you guys later.